My name is John Baptist Nkuranga. I'm a pediatrician and a neonatologist. So I manage the newborn care unit or the neonatal intensive care unit here at King Faisal Hospital. Overall, I have spent about 14 to 15 years career in medicine, but I've been practicing as a neonatologist for the last 5 years. Actually, for me, the inspiration was early on in the process. By the time it was my final years of medical school, I knew that I wanted either to do pediatrics or to pursue a career in public health. I was fortunate to get an opportunity to go into pediatrics. And quite interestingly, since I graduated from medical school, I have never applied a job in any other department. First of all, when we talk about the opportunities, the fact is that this is a field of medicine that is underexploited in many ways. You have to understand that every family will have a child, every family will have a baby, every family will have a risk of having a child that is born before time. And in that context, every family, as I said, at some point will need the best care possible, and the best care possible for newborn will be offered by neonatologists. And you can do a lot. The broad approach of what's available, you can do neonatology as a clinician in the hospital, in the clinics. You can do neonatology as a researcher, as a public health expert, where you help the government, the institutions, to prevent and to address challenges that are faced, public health challenges that face newborn that are born across the country. Or you can do both, just like I'm trying to do both. You can be a clinician as well become an academician. The main thing really is that we, especially in the Rwandan context, we are at the edge of people wondering, is it worth it to pursue the medicine into subspecialty, because it's a very lengthy journey. And sometimes it tends to fend off some people, to discourage some people to say, I did medical school for 5 years, then I do residence for 3 to 4 years, and then I do fellowship. Some people might think. But truth is, if you focus and you narrow down what you want, and you pursue what you want in a timely manner, you never know how the time has elapsed in a shorter period of time. The problem is, if you're not decided, you first do this and then do this, and by the time you go into the whole process, it's too late and takes a lot of time. That's what discourages some people. So what I really want to focus on is that the medical students, when they do their rotations, they need to start thinking about, where is my interest? Where am I keen to pursue more career? If you do a residence, then it's time to narrow down. Don't wait until you finish and then you start thinking about your career perspective, your future career orientation, where you need to be. Just in the process, just as you learn medicine, just as you learn other skills, try to figure out what you want. Do it in good time, and you will finish, get relieved, and you will be expert to do that. Lastly, it's about the social and socio-economic factors. Do I need really to pursue a subspecialty training and become, or do I need to go in private practice and just practice as a GP or as a general practitioner? I think the category is the same. Where the future goes in Rwanda, like any other country, the country is developing. As time more specialists comes, more responsibilities are going to be handed over to specialists. And more clinics will be looking to specialists and not the GPs. So I don't ask people to start chasing when time is gone, to be the right time they want to do that, but rather to be proactive, to plan ahead, to identify where their interest lies, and then the opportunities abroad are there. And I really want to encourage the medical students, the junior doctors, that they cannot exhaust these opportunities.